If you're dealing with lumbar instability, either from spondylolisthesis, stenosis, or herniated disc, I'm going to show you 4 rehabilitation exercises that you can do that require little or no motion whatsoever. Hi, I'm Lauren Irk. Welcome to Fitness Integrated Science. Conditions like spondylolisthesis, spinal stenosis, and herniated discs are often very painful for people to deal with, and certain positions can actually cause their spine to flare up and their muscles to seize up, dealing with pain and instability. Many times I've had clients that have come away from their doctor's appointment saying that their doctor said never flex forward or never rotate or never move, but in reality, living life requires us to move. We can't always know when we have to, for instance, bend over to pick something up or reach back over the seat or even bend backwards just to look up at something. So we have to figure out a way to strengthen our core that's not going to exacerbate the problems that we're already dealing with. Now, all of these 3 conditions are very complex and could be potentially very different. And I'm certainly not here to tell you that these 4 exercises are the only ones that you can do, and everyone's condition might just be a little bit different. But one thing that I always tell my clients, the most important thing that we have is range of motion observation. I have seen some clients with such bad spondylolisthesis that sitting on the ground with their legs in front of them or even sitting in a chair feels uncomfortable, and bending backwards is next to impossible. And I've had other people where they actually are fairly functional, but they just have to stay within their confines of what their range of motion dictates. So I would highly recommend that you listen to some of the cues that I'm telling you and modify when needed. Now I'm going to show you 4 exercises that you can do that can actually help you with these conditions to strengthen your core and help make your lumbar spine, which is where a lot of these conditions take place, a little more stable. Now, I'm going to come on down to the floor, and for my first exercise, I'd like to go over what I like to call the tabletop exercise. Now, when we're lying on the ground, this is actually a position for a lot of people that feels the most comfortable because the floor is actually supporting us. When you bend your knees and put your feet flat on the ground, this actually places the spine in a position of flexion. In other words, we're taking our lumbar curve and we're straightening it out. So what I would definitely tell people to do to begin with is notice already, does this violate your range of motion? Do you feel like you can actually lay flat on the ground with your knees flexed? If you need to place something underneath your lower back to make it more comfortable, please feel free to do that. Taking a deep breath in through the nose, notice how your rib cage actually expands, and this causes your lower back to lift up. So this is going to be called extension. As we exhale, notice how the lower back actually flattens out. This is that spinal flexion. Again, the pelvis actually posteriorly tilts, and we notice that that pubic bone kind of sinks in. On the inhalation breath, we notice that that lower back starts to come out, and then the exhalation breath, the lower back starts to come in. So notice where your position is, and then on your last exhalation breath, I encourage you to sort of hold this there. Now, pick up one of your legs at a time. Now, the sheer weight of your legs will cause you to go into that posterior pelvic tilt, meaning that the tailbone is sort of tilted up off the ground, the lumbar spine is really flat into the floor, and the hips are in a position of flexion. For a lot of people dealing with something like spondylolisthesis, this actually feels really good. So from there now, I want you to take a deep breath in and just start to tighten through your abdominal muscles. Now, when your knees are at your chest, this is going to be the easiest position to deal with. As you inhale, notice if you're able to maintain your spine as you start to move your legs away from you. Now, right now, I am dealing with the weight of my lower legs. They are causing me to move into that anterior tilt, which is not going to feel good on someone with something like spondylolisthesis. If you have spinal stenosis, you may notice that certain positions actually will pinch the spinal cord, and certainly depending on where your herniated disc has herniated, whether it's to the left or to the right, this is going to be worse on one side to the other. So find your position that feels good, whether it's close to your body or further away. Obviously, further away is going to be harder. Now press your shoulders down into the ground, press your arms into the ground, and see if you can just breathe normally, maintaining a certain amount of tension in your abdominal muscles, namely the rectus abdominis, because that's going to attach right down on the top of that pubic bone, draw your rib cage down and keep you in that posterior tilt. This is going to feel good for a lot of people. Now see if you can start to move one leg further away and then bring it right back to the center. Then move the other leg further away. And what you may notice is that one side is a lot harder than the other. If that's the case, feel free to draw your legs closer in and also keep that leg closer to home base. But this is a great way to train spinal rotation without rotating. We're trying to maintain that position of the spine. We're maintaining spinal flexion, and we're maintaining somewhat the anterior tilt. Posterior tilt. I want you to take your time with this. Use your breathing cycles. So as you inhale, notice your rib cage expands, and as you exhale, this is a lot of times where people start to move. Notice if you're able to keep that lower back on the ground, and if not, do less repetitions, use less distance, and also slow things down. Now from here, holding that, notice if you can add shoulder flexion, which is going to really push that extension up into the thoracic spine. So you have to almost tighten up into the abdominal muscles even more. You may actually limit your amount of shoulder flexion that you use. So let's just say that we start from here, pressing that lower back into the floor. Let's move the right shoulder into just a little bit of flexion, and then take your left leg away from you into a little bit of extension. Then as you exhale, can we return right back to home base? So I would definitely recommend starting off slow. Stay close to home base. Work on keeping that lower back flat to the floor. Make sure you can breathe normally. Keep those abdominal muscles strong. And then over time, if it's appropriate for you, you may be able to increase the distance between your limbs. But remember, we have longer lever lengths. This is going to be harder for those spinal segments to remain stable due to potentially abdominal weakness and pre-existing conditions. For some people, this is not going to be appropriate at all, and I would definitely recommend just work on holding this still before I ever added motion. So that's my first exercise. Now for my next exercise, I'd like to talk about the plank. Now the plank is oftentimes talked about as being the best exercise for your core, and I would say it is a great exercise for the core, but one thing that's great for these things is that it doesn't require you to really change positions in your spine. So for instance, if I come around onto all fours, stacking my shoulders directly over the top of the wrists, gravity itself is pushing my spine into a position of extension. And again, this is going to be a lot of times where the Spondylolisthesis patients would have the hardest time because they tend to have more displacement right around L5, L4, L5, L5, S1. So tightening the abdominal muscles and keeping that midsection tight is very important. One thing you can do is pull the hands isometrically towards the knees and vice versa, pushing the knees towards the hands. That's going to really set in with those abdominal muscles. Now before we start to open up plank, just try lifting your knees off the floor, keeping your arms and knees close together, and see if you can hold that here. Great way to train spinal flexion without actually having to flex the spine. From there, you can actually work to open up the distance from front to back. As you do this, as we increase our moment arm, we're picking up the knees here so that now we have greater distance between our hands and feet. Longer levers, stomach working a lot harder. And then over time, in a full plank, you can see that I have a lot of distance now between my upper and lower body. Gravity definitely pushing me into hip extension, so spinal extension as well. So I'm working hard on keeping my midsection pulled up. So again, until we have the strength to deal with the full plank, I would definitely recommend moving into more of a quadruped situation. Now, depending on particularly someone with stenosis or a herniated disc, you may have had one side of your body feel more painful than the other, but I want you to turn to your side now and come up onto your elbow. Try to make sure that your shoulder is in line with your elbow versus out in front of it so that we're not trading one problem for another, feeling our shoulder muscles. And I'm going to start with both of my knees flexed. Now, the action of gravity is pushing me into lateral flexion. So when I focus on drawing my ribs to my hips on the bottom side, I'm actually working my lateral stabilizers without actually moving. So the first thing I would do is just here on the ground, working on pulling my elbow towards my knee. When you get better, you can actually stabilize through the shoulder and begin lifting your knees off the ground, which is definitely going to put a lot more pressure on the bottom side, the side that's facing the floor, including muscles down into the hips. But did you notice my spine really didn't have to move as long as I engaged my muscles here? Over time, as you got better, you could actually move your legs out, maybe separating your legs and moving from here. Now we have a much greater attachment, and obviously you could practice moving into where you have less surface area. A lot of this is going to be dictated by what your shoulder can handle and certainly what your spine can handle. Now for my next exercise is just going to be the opposite of what we did. Now we have the bridge exercise. Now you're thinking, if you have spondylolisthesis, extension or bending backwards is one of the worst things that people feel like is detrimental to their spine. So how do we work our extensor muscles without actually putting a lot of pressure right along that lower back, which is already unstable? One of the things that I like to do as I come down into that bridge position is I work on what's called a posterior tilt. So again, if we go back to that flattening of the lower back, where we can tighten into the gluteal muscles and set the thing up just right away, draw the shoulders into the floor, remain neutral at the neck. Then from there, we just simply move the hips off the ground. Now the height of the bridge to me is not as important. Just go to a position that you can handle. And when you get to the top, if you're truly squeezing your glutes, it's going to be really hard for you to really put a lot of hyperextension, meaning extension beyond neutral, into your lower back. Now there are people, certainly all the years that I've taught yoga, I've seen people come way up into these poses and positions and really get a big arch in the back. But if you're dealing with a spinal condition that makes it difficult for you to come into extension, this is a great way to work this. If you notice, my hips are actually below the level of my knees and my shoulders, and I can really work on extending through the spine without actually having to bend backwards quite a lot. From here, once I get to the top, I could press into one side a little bit more than the other so that now I can introduce some rotation while I'm in extension and then coming back down. Make sure to rest adequately between and just notice how you're feeling. When we set up into the next one, flatten out that lower back, and as you come up, work to push through your heels and use your gluteal muscles to come up to the top, working to not let go of that posterior pelvic tilt, holding that here, and then exhale, coming right back down. Now for my last exercise, this is also going to be a great one for your lower back. I like to call this the quadruped exercise, which I'm sure you have seen. Imagine that you have your back flat to the ceiling, like the roof is right above you, and then you have some gum on your hands and knees. That's the one thing I always like to use as a visual. So what I'm going to do is I'm going to take my right hand off the floor and my left knee off the floor, seeing that I can hold and stabilize, and then exhale down. And you felt that you have actual resistance going through your back. And then as we do that again, we hold it up. So this is actually working spinal extensors without having to bring in the hip joint. So this is a great interim step. As you get better, you can actually incorporate, since we're starting off along the floor, I can start to incorporate moving the arms and legs away from each other. I'm still not at full hip extension right now. I'm making sure that my lower back can stay here, and then bringing that back down, and then changing sides. You may notice that one side of your body is actually able to get into this position a little bit easier than the other. Definitely want to take note of that. Over time, of course, the optimal position would be to go into full hip extension, whatever that looks like for you. But again, if you're dealing with something that's rather painful, you may notice that it limits your range of motion. Remember that if I come into whatever position I have, Really engage the muscle, hold it for a few seconds. Over time, as muscles get stronger, the body may actually signal more stability. This can actually reduce pain and maybe improve your range of motion. But again, don't get attached to what the exercise is supposed to look like from a magazine or from what you've seen. Work within the ranges that you have and see what you can do without pain. Over time, as the muscles around the front of your spine, the sides of your spine, and the back, working three-dimensionally through the core, we can actually perform these exercises with very little to no motion and still remain strong in our core, which is essential if you're dealing with lumbar instability. I hope this video helped you. If you did like it, please give me a thumbs up and share it with your friends if you know someone that we can help. Make sure you've rung the bell so that you don't miss another video. And if you'd like more information about longer sessions and programs, please head on over to Fitness Integrated Science TV, where I have lots of programs that are specifically designed to deal with low back instability. Thanks for watching, and I'll see you on the next video.